afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to make a better system for all of us. We have a lot of topics today. Today is March 11th, 2025. We have a lot of topics to cover today because there's so much chaos going on in the government, especially with healthcare. But let me point out that down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter. Subscribe for free, get these delivered to your inbox every day as emails, and all the actions that I mention, all of the research studies, news reports, they're all in that newsletter. You can just go there, and all of this is free. So, RFK Jr. is a public menace. His view is that there is no need to increase vaccination levels. The National Institute of Health is now going to cancel or cut back dozens of grants for research to determine why some people are reluctant to be vaccinated and how to increase the acceptance of vaccines. This is according to an internal email that was obtained by the Washington Post yesterday. The email was titled Required Terminations 3/10/25. It shows that on Monday morning, the agency received a new list of awards that need to be terminated today. It has been determined that they do not align with National Institute of Health funding priorities related to vaccine hesitancy or uptake. Robert F. Kennedy Jr., the new secretary of NIH's parent agency, the Department of Health and Human Services, has disparaged vaccines for years. Last week, the Center for Disease Control and Prevention, another part of HHS, was asked by the Trump administration to launch a study into a possible connection between vaccines and autism, which is so much bullshit. The guy that discovered that in England, the doctor who actually promulgated that lie, lost his medical license. Anyway, this is despite research that demonstrates that there is no link between autism and vaccinations. Trump halts medical research at the VA. This is a particularly egregious one. At the VA hospital in Pittsburgh, researchers were spending months getting ready for a new clinical trial of a brand new drug to treat advanced cancers of the mouth, throat, and voice box. They were finally ready last month to start enrolling patients, veterans whose cancer had spread to other tissues, and they were out of treatment options, so death is waiting for them. Then there's a problem that popped up. The problem was Trump. The hospital was unable to renew the job of a key staff member involved in running the study. This is a typically routine process, and it was thwarted by a hiring freeze imposed by the government-cutting project led by Trump and Elon Musk. Suddenly, the clinical trial is on hold. They were ready to enroll, said Alana Kaffis, who's the chief executive of the Veterans Health Foundation that administers the trials. They had the lab kits on site, they had the drugs ready to dispense, but they couldn't get the clinical research coordinator renewed. While Trump administration officials have claimed to preserve core patient services, cuts at the VA have nonetheless spawned a chaotic ripple effect. They have disrupted studies involving patients waiting for experimental treatments. They have forced some facilities to fire support staff and created uncertainty amid the mass cancellation and partial reinstatement of hundreds of contracts targeted by Musk's Department of Government Efficiency, which is, just like everything else they do, the exact opposite. This is malfeasance. I am not interested in knowing if the Trump acolytes are uninformed or just hateful. I'm only interested in the result, and that has to stop. Let's talk about censorship at the National Institutes of Health. Employees at the National Cancer Institute, which is part of the National Institutes of Health, have received internal guidance this past week to flag manuscripts, presentations, or other communications for scrutiny if they address controversial, high-profile, or sensitive topics. There are 23 hot-button issues, and they include fun things like vaccinations, fluoride, peanut allergies, autism. You can't talk about any of those. All materials have to be reviewed by an institute clearance team. You can read that as the censorship board, according to the records, and could be examined by officials at NIH or the Department of Health and Human Services. The list of topics is long. It includes things like bird flu, COVID-19, as I mentioned, autism, vaccinations. It just goes on and on and on. Mostly, they are willing to let things go and be published, provided that the content does not create a major media storm. They want no attention. They want to make sure that anything you release is non-controversial and not sensitive and does not touch on any administration priorities. This is a real interference in the scientific process, said Linda Birnbaum, former director of the National Institute of Environmental Health Sciences, who served as a federal scientist for 4 decades. The list, she says, is just Big Brother intimidation. During the first 2 months of Trump's second presidency, his administration has slashed funding for research institutions and has stalled the NIH's grant application process. Kennedy has suggested that hundreds of NIH staffers need to be fired and said that the institute should deprioritize infectious diseases like COVID-19. Better to shift your focus to chronic things like diabetes and obesity. This was all according to ProPublica. It's so disturbing. Let's take an action. Call your congressperson and your senators. Tell them that you demand that our tax money be spent on real medical scientific investigations that can improve health at NIH and at the VA. Stop the waste, fraud, and abuse promulgating fake anti-vaccine studies meant to discourage public health. Those are fraudulent studies, and they are propaganda for those who are anti-vaccination, anti-pandemic preparedness, anti-science, and who are opposed to education. There's a link in the YouTube description box. You can get their phone number or email, or my favorite way, on your cell phone, send a text message, SIGN, S-I-G-N, space, PALXDE. That's SIGN, space, PALXDE to 50409. I am your constituent, and I am appalled that the VA is canceling critical medical trials of important new cancer drugs. The staff in charge of the trials has been fired. The National Institute of Health now has a censorship board opposed to any research on vaccines, pandemic preparedness, stem cell research, autism, peanut butter. The list goes on and on. We are being taken into a medical dark ages by those that have no interest in improving health. I call upon you to change the research direction back to improving health instead of anti-medical propaganda at the VA and the NIH. Your constituents are counting on you. Okay, that's what I've got for you. Down below, you can like, share, subscribe. You can send comments to me here in YouTube or at healthcareadvocacy1, all one word, @gmail.com. Have a good afternoon.